Okay. And you also did a CT. Do you have a CT
Yes.
grading system that you use?
Yes. Yes, sir. So, based on CT grading, we can use modified Fisher scale, sir. It has four grades. So, first one is thin SAH, that is less than 1 mm thickness, and it won't have any, those patients won't have any intraventricular hemorrhage. So, grade 2 is again thin SAH, but with the presence of intraventricular hemorrhage. And grade 3 is thick SAH, that is more than 1 mm thickness of the bleed, but without intraventricular hemorrhage. And grade 4 is thick SAH with intraventricular hemorrhage.
Okay.
So this
So
patient is
thin
yes, sir.
intraventricular hemorrhage with and without IVH is 1 and 2. Thick
Yes,
SAH that is more than 1 millimeter in size with or without IVH will be 3 and 4. That's what it is, right? So in
yes.
your patient, what will be your grading?
So this patient is having a subsequent hemorrhage of thickness at 12 mm by 4 mm size. So she will come for, but no intraventricular hemorrhage in the initial CT. So grade 3 modified Fisher gradings.
Okay, so it is more than 1 millimeter in size, so it's grade 3. And
3.
you talked about the Hunt and Hess and WFNS used as a predictor of mortality. So,
Yes.
what is the usefulness of grading somebody? Why take the trouble of grading them using this Fisher or the modified Fisher scale? What additional information do you get?
So this can predict with what percentage the patient can land up in vasospasm and further complications of delayed cerebral ischemia, cerebral infarctions.
Okay.